So let's start with the possible causes for the long COVID. There is a theory in immunology of virus hit and run, where the virus arrives, does some disease, causes some pathology, and in that process ends up triggering the immune system, dysregulating it, and then the virus is wiped out. But the immune system behind is still dysregulated. It is still wobbly. It is still incorrectly functioning. And that continues to go on, and that becomes the basis for a chronic disease. So that hit and run is possible. I think it is very much possible with COVID. That's one. The second pathology, and I have given the references before, the S1 protein pieces sitting in the monocyte. And again, you may have a lot of questions that why are they sitting in there? How long would they continue to sit in there? Will they ever get eradicated? Would they ever be cleared? What is the outcome of the S1 sitting in the monocyte? All of those questions are in the paper and the answers to them.
And just to specify for people, this is a piece of the spike protein. We've been talking this.
Correct. Absolutely. And so if you would like, give me 1 second. So I hope you can see my drawing board now. So on the virus, so let's say this is SARS-CoV-2. On the virus, the spike protein is divided for its functional pieces. It has a receptor binding domain, or RBD. This is where it binds to ACE2. So that is one. So this blue part is the ACE2. This is the remaining cell. The red part is receptor binding domain. Then for the remaining part of the spike protein, there is an S1 unit and there is an S2 unit. And for completion's sake, what happens is when the virus comes and docks with the ACE2, this is ACE2, the blue one.
Right.
When the virus docks with the ACE2, then the TMPRSS2, that is a surface protein on our cells, it cleaves a part of the S1 from S2, which causes this whole S1 and S2 to become separated. Now, S1 stays stuck to the ACE2, and it is actually recycled or downregulated and brought into the cell for digestion. However, the S2, and please don't mind, my cat is here with me and it is going to start meowing. It just woke up. The S2 portion that is then made naked because S1 is removed. This S2 portion acts as a fusion protein and it connects with the cell membrane, and then it allows the virus to fuse and send the RNA in. This is the normal function. We are talking about this part, the S1 part, sitting in the monocyte. So let's say this is a monocyte. This S1 part is somehow hanging out in monocyte for months and months in some people. And that causes this monocyte to become dysregulated because it has an antigen in it, and it would present that, and the other cell would trigger it, and the monocyte itself would continue to be triggered and make cytokines, which causes it to cause continuous inflammation. Now the monocytes are, again, they are in 3 states. I'm so sorry I'm going on with all in this depth. You can stop whenever you like.
Well, no, this is fine. Just one thing that's always interested me about this story is that the monocyte normally has a very short lifespan, I would imagine.
Correct.
And so there's something about this, once it's in there, that kind of immortalizes it a bit.
Correct. So they discuss that in this paper as well. There are a couple of possibilities. So let me complete my blood vessel part, and then I'm going to address that question. That's actually a beautiful question, and it is asked very often. And that was my curiosity as well. And we still only have conjectures about it. So let's say this is a blood vessel, and outside is a monocyte. Monocytes usually patrol the boundaries of our interfaces, our tissue interfaces. Blood vessels are interfaces. There are other interfaces as well in our tissues. So monocytes are patrolling there, and when needed, they can convert into macrophages. They can convert from classical to non-classical and intermediate. However, if they are irritated by this antigen present in them, then they continue to create inflammatory state around the blood vessels, which causes the blood vessels to become inflamed. And we see a lot of pathology related to that.
Yeah.
So having said that, the question, monocytes are supposed to be either short-lived or convert into macrophages and be long-lived. How do they start surviving? So in this paper, Bruce Patterson and Yo, or doctors, they discuss that it is possible that the continuous irritation of the monocyte makes it not become cleared out, or it is possible that the one monocyte is eaten up by another as part of the regular homeostatic mechanism, where a senescent cell is removed by phagocytosis from another cell. And when it is eaten up by another cell, then the spike protein just transfers to the next one. So it is now going from cell to cell and sticking in there and keeping the dysregulation continuing. There may be more mechanisms, but these are some that they have done.